Hi all. So June 14th is celebrated as World Blood Donors Day. Being a hematologist, I know the value for each and every single drop of blood. So I would take this opportunity to discuss with you about World Blood Donors Day. What is the requirement of blood? What is the requirement of a donor or a voluntary donor? And why is it so important for us to donate blood for the community? So as per statistics, the number of countries that source most of their blood from voluntary blood donations is approximately only 62 to 65. The rest of the countries still depends on SOS or on-demand blood donation that has to be usually arranged by the patient or the patient's family. These are alarming numbers. With the diagnosis of cancer now increasing by huge numbers and a lot of patients requiring chemotherapy, radiation and surgery, naturally the demand for blood in the patient community has gone up significantly. Still, if you go to most hospitals, you are told to bring your own donor because there is still a huge shortage of blood in the community. Why is this the case? Why are we still hesitant about donating blood? And why don't we make it a part of our routine to donate blood at least 3 to 4 times a year? The reason is because there's still a lot of myths about blood donation in the community. Lesser so in the urban population, but definitely the gap is huge and these myths are very prevalent in the rural populations. What are the things that a blood donor, what is the requirement from a blood donor? So let me just elucidate these important points so that a lot of myths are cleared and I'm able to at least encourage a few more people to go and donate blood so that we bridge the gap between blood requirement and blood donation. So for blood donation to be a healthy, fit donor, you have to fulfill the following criteria. You have to be between the age of 18 to 50 to 55. You have to have a hemoglobin of at least 12 and above. You should not have any major medical disorders like diabetes, severe uncontrolled hypertension, having other blood disorders like maybe thalassemia or polycythemia, or blood disorders that would cause your hemoglobin to be very low, below the range of 11 or 12, or very high, above the range of 17 to 18. These are pretty much the only requirements. Apart from this, yes, it is preferable if you are a non-smoker and a non-alcoholic or occasional alcoholic and you don't have other bad habits. What is primarily the good frequency at which you can donate blood? There's a lot of myth associated with blood donation. People think after I donate blood, I can't go to work that day. You'll feel weak, you will feel very tired, you'll not be able to do your daily activities. So these are the major myths, right? So what you require after blood donation is mostly hydration and maybe some glucose, because the amount of blood that is taken out of our body is actually a very minuscule amount compared to what is made in our body on a minute-to-minute basis. So pretty much the amount of blood that is taken out, for it to regenerate in our body, takes about 1 or 2 days, and that is it. And even that amount of time, you might feel slightly dehydrated if you have not hydrated yourself after the blood donation. What is a good frequency to donate? A healthy person can donate blood almost once every 3 to 4 months, which means up to 3 to 4 times a year would be very safe if you fall in the category and you're able to fulfill these criteria. It would be very safe for you to donate blood, especially if you are a rare blood group owner. If you have a rare blood group, which in our communities tend to be O negative, A negative, B negative, and AB negative. Of course, also O positive, which can be given to other blood group patients, is also in high demand. Apart from blood, you can also donate platelets. You can donate what we call fresh frozen plasma. So there is a huge requirement for blood in the community. And on this World Donors Day, Blood Donors Day, I would really take this opportunity to try to encourage most of my patients, most of my patients' families. Today it is somebody in your friend's family. Tomorrow it might be someone in your family that really requires blood, especially in an emergent way. So please consider my request as a hematologist to consider and go try to at least get yourself screened to be a potential donor. Thank you.